Hey everyone, Dr. Kevin here over Hey everyone, Dr. Kevin here over at HealthFit.
And I'm Dr. Joe, and we're going to go over the deadlift position with you today. Now, for most people, they typically find discomfort, especially when we see people for low back pain in the office. Most times than not, they've had some sort of lifting issue, whether they were actually deadlifting or they were making a deadlift type motion. So we want to go over some of the do's and don'ts that you probably are familiar with if you have some of this pain.
Deadlift motion, we're going to go down. You see people like reaching down just to kind of do that all the time. The actual movement with the weight, so well, not a weight, but just having something to guide is we have the bar, we're going to go down, we're going to come back up, we're going to go down, we're going to come back up.
Now, we're going to get a little bit more specific with it. So Dr. Kevin's going to face that way. What you're not seeing in his spine is most of his motion as he tilts forward, if this were his hips, he's tilting from his pelvis, not making as much motion from his spine. So for a lot of people, they end up motioning more from their spine, especially their low back or their mid back. Dr. Kevin, can you show them an example? And so it doesn't look that much different than the usual, but in that case, his pelvis actually stays upright and pushes back as his spine does all the work. See these tiny little joints here? Those are the spinal joints. These are big hip joints. That pressure when you're picking up 200 pounds of weight, 100 pounds of weight, or just your bag, that pressure is much more efficient moving through this big hip joint than it is these tiny spinal joints. When you sprain these tiny spinal joints like you would your ankle, that's what puts you debilitated after doing something like a deadlift. But when you're putting yourself in a good position, the deadlift's one of the best exercises to help strengthen and stabilize your low back. So you really want to be able to focus on moving through that hip hinge is what we call it. That last little bit of the motion to really get down lower to the ground, Dr. Kevin's able to get out of his knees. This brings up a great point. If you are restricted in your ankle range of motion, in your knee range of motion, and your hip range of motion, it's going to be very difficult for you to distribute the load more evenly around your system. So the idea is to be able to have proper mobility from the hip to the knee to the ankle to allow that stress to stay in the big structures instead of going into the tiny structures around the spine. A good example of this is if you're feeling more sore in your back than you are your glutes after doing deadlifts, then you're probably not getting the most out of it that you can. And so there's a lot of different ways to go about this movement. There's a lot of different variations to get different engagements and different muscle specificity through the movement. When we go over it in the office, we're always talking about stability, protective natures for the future, and making sure that you can preserve your motion when you're in your 70s, 80s, and 90s.
One of the other things too, we talked a little bit about this excessive rounding of the back. Now, I'm exaggerating obviously, but for illustration purposes, the other way that we oftentimes see people doing it is because you're taught to, really engage here and lock out your back, people are like, they start from this position. And so they have a lot of extension, they have a lot of arch in the back. And so when they come up, they start moving with their back first, as opposed to being able to get a comfortable position, and then you're gonna be able to use your hips, pushing away from the ground and lifting the weight up. So those are some of the things that we see more commonly that lead to people having some sort of discomfort, whether it's at the hip, at the back, or at the knee. So guys, if you guys have any questions or comments, please feel free to contact us over at
HealthFitInc.com.
Have a great day!